Childhood obesity is a growing concern worldwide, affecting over 340 million children and adolescents globally. Obesity in children can lead to various health problems, including diabetes, cardiovascular diseases, and nonalcoholic fatty liver disease, NAFLD. It is a chronic liver condition that affects up to 40% of obese children, and it can lead to liver damage and other serious health complications. In this video, we will discuss the link between obesity in children and NAFLD and explore preventive measures that can help reduce the risk of developing the disease. So don't skip the video and watch until the end. So what is NAFLD? It is a liver condition that occurs when the liver cells accumulate fat. It is not caused by excessive alcohol consumption but rather by metabolic disorders such as obesity, diabetes, and high cholesterol levels. NAFLD can lead to liver damage, inflammation, and scarring, and in severe cases, it can progress to cirrhosis, liver failure, and liver cancer. Symptoms of NAFLD in children. NAFLD can be asymptomatic, meaning that some children may not show any symptoms at all. However, some children with NAFLD may experience fatigue, abdominal pain, and enlarged liver. In severe cases, children may develop liver scarring or cirrhosis, which can cause jaundice, easy bruising, and an increased risk of bleeding. Causes of NAFLD in children. The exact cause in children is not known, but it is believed to be related to metabolic disorders such as obesity, insulin resistance, and high cholesterol levels. These conditions can cause the liver to accumulate fat, leading to liver damage and inflammation. Other factors that can increase the risk of NAFLD in children include a family history of the disease, a high-fat diet, and a sedentary lifestyle. The relationship between obesity and NAFLD in children. Obesity is the primary risk factor for NAFLD in children, and up to 40% of obese children may have the disease. Excess body weight can cause insulin resistance and metabolic disturbances, which can lead to the accumulation of fat in the liver cells. Studies have shown that weight loss and lifestyle modifications can improve it in children, underscoring the importance of early intervention. The role of diet in NAFLD prevention. A healthy diet can play a crucial role in preventing NAFLD in children. Children should consume a balanced diet that includes plenty of fruits, vegetables, whole grains, and lean protein. They should also limit their intake of sugary drinks, fast foods, and processed foods. A diet high in saturated and trans fats can increase the risk in children, so it is essential to limit the consumption of these fats. The importance of physical activity in NAFLD prevention. Regular physical activity is another crucial factor in preventing in children. Exercise can help improve insulin sensitivity, reduce liver fat, and lower the risk of developing NAFLD. Children should engage in at least 60 minutes of moderate to vigorous physical activity every day. Parents and caregivers can encourage children to participate in activities they enjoy, such as sports, dance, or biking. Managing NAFLD in children. If a child is diagnosed, the goal of treatment is to prevent or slow down the progression of liver damage. This can be achieved through lifestyle modifications such as weight loss, dietary changes, and regular exercise. In some cases, medication may be necessary to manage specific symptoms or complications of the disease. It is essential to work with a healthcare professional to develop a treatment plan that is tailored to the child's individual needs. Diagnosing NAFLD in children. It can be challenging, as many children with the disease may not show any symptoms. A healthcare professional may suspect NAFLD if a child has elevated liver enzymes or if an imaging test shows an enlarged liver. Further tests may be necessary to confirm the diagnosis, such as a liver biopsy or a non-invasive test called FibroScan. Treating NAFLD in children. It requires a comprehensive approach that includes lifestyle modifications and, in some cases, medication. Children with NAFLD should aim to achieve and maintain a healthy weight, eat a balanced diet, and engage in regular physical activity. Medications may be necessary to manage specific symptoms or complications of the disease, but they should only be prescribed by a healthcare professional. Complications of NAFLD in children. NAFLD can lead to liver damage, inflammation, and scarring, which can progress to cirrhosis, liver failure, and liver cancer. Children with NAFLD are also at increased risk of developing metabolic disorders such as type 2 diabetes, high blood pressure, and high cholesterol levels. It is essential to manage NAFLD in children promptly to prevent these complications from developing. Preventing NAFLD in children. It requires a comprehensive approach that includes healthy eating habits, regular physical activity, and weight management. Parents and caregivers can encourage children to consume a balanced diet, limit their intake of sugary and processed foods, and engage in regular physical activity. Regular checkups with a healthcare professional can also help detect and manage any underlying conditions that may increase the risk of NAFLD. If you like my video, then subscribe to my channel. Thanks for watching my video.